command our deliberation in so just and faithful a manner as to promote your honor and glory, and to advance the peace, prosperity, and welfare of our county, and of those whose interest you have committed to our church. Amen. Okay, welcome honorable members. Clerk, kindly take us through the items in the order paper.
Order number 1, administration of oath. Order number 2, communication from the chair.
Thank you. Once again, honorable members. In the public gallery, we have students from Bomet University who are pursuing public relations and communications. They are visiting the assembly this afternoon, and I want to take this opportunity to welcome them, that you are highly welcome in the county assembly of Bomet. While you are in the public gallery, you will be required to maintain silence, and you make observations. There is thank you so much. They are the following: Shadrach Kimutai, Obala Francis, Koej Mark, Koskei Brian, Opia Oguta Emmanuel, Keliam Kalama. We've also been joined by a member of public from Kipsonai Ward. You're also highly welcome. By the name Joyce Cheruyot. And on behalf of the members of this county assembly, I want to ask Honorable Peter Rono, MCA from Kipsonai Ward, to take a minute and welcome the students from Bomet University, including a member from your ward.
Mheshimiwa Spika, kielelezo chako ni dhahiri. Kwa nafasi hii nikubalie niwakaribishe wananchi tukufu kwenye jengo hili la bunge letu gatuzi la Bomet. Niwatakie kila laheri wanapofuatilia majadiliano yetu na mkataba uliowekwa kisheria. Humu ndimo sisi tunatekeleza jukumu kubwa tulilopewa na sheria la kuunda na kutunga sheria na kutungua pia. Pia hapa tunapendekeza matakwa na matarajio ya wananchi waliotutuma, na hivyo basi kujumuika kwenu nazi hapa ni ili muwe mashahidi ya kwamba kuna kazi inaendelea. Raia wote ambao wamekubaliwa kujumuika na sisi hapa, kuna taswira na namna wanaotakiwa kukaa, na hivyo basi spika atawaeleza hiyo. Na kwa muda huo nawakaribisha nyote, mjisikie mko huru. Hata hivyo uhuru wenu kuna
Okay, thank you, Honorable Member. Clerk.
Order number 3, messages. Order number 4, petitions. Order number 5, papers.
Thank you, Honorable Speaker. And let me take this opportunity also to welcome my colleagues to the, after recess, back to this Honorable House. Honorable Speaker, I beg to table the report on Bomet County Comprehensive Eye Health Care Policy 2025, sessional paper number 1 of 2025. I beg to table.
Kindly proceed. Clerk.
Order number 6, notices of motions.
Thank you, Honorable Speaker, again. Honorable Speaker, I beg to give the following notice of motion. Honorable Speaker, that pursuant to Standing Order number 2055B of the County Assembly Standing Orders, this County Assembly adopt the report of the County Assembly Committee on Health and Sanitation on Bomet County Comprehensive Eye Health Care Policy 2025, sessional paper number 1 of 2025, pursuant to Article 185(4) of the Constitution, approved the Bomet County Comprehensive Eye Health Care Policy 2025, sessional paper number 1 of 2025, laid on the table on the table of the Assembly on 12 March 2025. Honorable Speaker, I beg also to, through your powers, Honorable Speaker, that you can give or grant this motion to be dealt with today, Honorable Speaker, because of the urgency of the policy. I beg, Honorable Speaker, maybe the House business can schedule through maybe giving some few minutes, Honorable Speaker, so that we deal with it, because it is urgent in our county to have this policy in place, Honorable Speaker. I beg to give this notice of motion.
Kindly proceed. Okay, thank you, Honorable Member. As you've requested, we'll give a ruling that this House be suspended for 15 minutes so that the House Business Committee can deliberate and slot the motion for deliberation this afternoon. Yeah, thank you.
Point of order, Honorable Speaker.
Okay, Honorable Peter.
Mr. Speaker, you are making a very pertinent ruling that the House Business Committee should retreat and find time for debating the motion. And Honorable Speaker, I'm not sure how urgent is the urgency that the chair is claiming, yet the policy has not been read by all of us. Mr. Speaker, I'm yet to be convinced whether we are supposed to deliberate on the policy and of course approve it today, because it will be a hazard for us. Some of us would want to know the details and of course make recommendations, if any. Mr. Speaker, if the 15 minutes is for the House Business Committee alone, then personally I would also seek a point of order to object the same, because unless you are saying we extend it for 1 hour so that some of us can read and comprehend and of course synthesize the details and the context of the policy, Mr. Speaker.
Point of information, Honorable Speaker.
Whom do you want to inform, Honorable?
The whole House.
Okay, kindly proceed.
Thank you, Honorable Speaker. As you are aware, we are part of the committee on health, and on Thursday last week, I was able to send a draft of the policy for all the members to be able to go through. And I believe Honorable Peter is among the members who are in the group. I don't know why he has not gone through. Maybe he was so busy in his constituency. But I believe all the members have the policy in their gadgets. Thank you.
Honorable member, did you see the posting in the wall for honorable members?
Mr. Speaker, honestly, you know, I'm 45, and the digital world, Mr. Speaker, I should be allowed to learn slowly. I must admit that I'm not an active member on either wall, the WhatsApp or Facebook. And I believe in hard copies, Honorable Speaker. You see, it's just getting to me in a minute, so you will forgive me for not reading. And with your permission, allow me some minutes to read it.
Okay, thank you. Honorable Chair, do you concur that the policy was posted on the wall earlier?
Yes, Honorable Speaker.
Yeah. Thank you. So the House stand suspended for 15 minutes.
number 7, questions and settlements.
Mr. Speaker, I want to take this opportunity first to welcome the visitors at the gallery at this county assembly. And secondly, Mr. Speaker, I'm seeking a comprehensive statement from the chairperson of the Committee on Agriculture, Fisheries, and Livestock regarding the expenditure of funds allocated to donor funds, National Agricultural Value Chain Development Project, that is the so-called NAFCBD. I wish to be furnished with a detailed breakdown of an expenditure of the said funds. Specifically, I seek the following information. 1, a detailed and itemized expenditure report for the financial year 2022-2023, including a breakdown of the specific projects implemented within each ward, along with their respective impacts and outcomes. Number 2, a comprehensive expenditure report for the year 2023-2024, outlining the specific projects undertaken in each ward, with a clear explanation of their objectives, progress, and any challenges encountered. Number 3, a detailed expenditure report for the first 9 months of this financial year 2024-2025, including an overview of the ongoing or completed projects in each ward and an assessment of the efficiency and effectiveness of funds utilization during this period. I beg to table, Mr. Speaker.
Yeah, kindly proceed. The paper which has been tabled by Honorable Ernest is committed to Committee on Agriculture, Livestock and Cooperatives. Chair, Agriculture, Livestock and Cooperative Committee.
Honorable Speaker, it is the Committee on Agriculture, Livestock and Fisheries. Mr. Speaker, the cooperatives element is domiciled in another committee, Mr. Speaker. And until I don't know whether you want the two committees to handle it, or it will be exclusively handled by the Committee on Agriculture, Livestock and Fisheries alone, Mr. Speaker.
The word cooperatives was mentioned erroneously. There is the committee which is supposed to handle this statement is Committee on Agriculture, Livestock and Fisheries. It will be done with this 21 days. Honorable
I'm seeing the chair is correct, Honorable Speaker, that maybe the report should be handled by the two committees, because so that we get a substantive answer to the seeker of the statement.
Honorable Speaker, as you consider the suggestion, I want to wholeheartedly say that the Committee on Agriculture, Livestock and Fisheries will handle the matter, and it is good because the seeker of the statement is outright. I see him, he has used very specific terms that we got to give an outline of programs or projects undertaken in each ward. The statement and the answers to the statement will help us unravel the truth as to whether the projects or the programs were ward-based or county-based. Because the preceding program, famously known as ASDSP, the Agricultural Sector Development Support Program, was undertaken in 6 wards across the whole county, Mr. Speaker. And NAF-CDP element, I don't know whether there is a report for 2022, because I understand the same was introduced in 2023. But nevertheless, the answers we will give here will be will justify either way. But the Committee on Agriculture will handle it comprehensively, Mr. Speaker. I oblige.
Yeah, thank you, Honorable Member. It will be your prerogative to even consult those other committees, because the member also talks of expenditure report. You may also not miss to contact the committee on finance. Otherwise, it will be upon the Committee on Agriculture to make sure that the question has been answered comprehensively, as it has been sorted by Honorable Member. Yeah, thank you. Clerk.
Order number 8, motion.
Point of order, Mr. Speaker.
Honorable Ernest.
I rise to ask and request that through your chair, you give us the time frame for the same.
Okay, I had asked the committee to expedite and report within 21 days. I mentioned 21 days. Yeah, thank you.
Okay. Thank you, Honorable Speaker. That pursuant to Standing Order 205B of the County Assembly Standing Orders, this County Assembly adopted the report of the County Assembly Committee on Health and Sanitation on Bomet Comprehensive Eye Care Health Policy 2025 Sessional Paper number 1 of 2025, pursuant to Article 185(4) of the Constitution, approved the Bomet County Comprehensive Eye Healthcare Policy 2025 Sessional Paper number 1 of 2025, laid on the table of the Assembly on 12 March 2025. Honorable Speaker, it is my privilege to present this report on behalf of the Committee on Health and Sanitation, detailing the findings of an observation and recommendation regarding the Bomet Comprehensive Eye Healthcare Policy 2025 of 2025. This report is a culmination of the extensive stakeholders engagement, policy analysis and assignment aimed at evaluating of effectiveness and feasibility, sustainability of the proposed policy interventions in the eye care in Bomet County. Mr. Speaker, the policy goal is to strengthen the eye care healthcare service through a comprehensive approach that focuses on the enhancing the infrastructure, maintaining the reliable supply of high healthcare products and technology, advancing human resource capacity building, improving accessibility of persons with disability, and utilizing modern technology. Honorable Speaker, the Committee on Health and Sanitation acknowledged the importance of the Bomet County Comprehensive High Healthcare Policy 2025 in addressing the preventions and blindness and improving access to eye healthcare service. Mr. Speaker, through the recommendation, because honorable members have this in their gadgets, the recommendation, the committee recommendation, Mr. Speaker, having reviewed the policy, the committee makes the following recommendation that the department should incorporate the legal framework as the policy's justifications. This ensures the policy is firmly grounded in the law and aligned with the national development goals. It is essential to anchor it within the extent the existing legal and policy framework. This includes by integrating this legal and policy instrument, policy gains the necessary legitimacy, ensuring its implementations aligns with constitutional provisions, national development objectives. Mr. Speaker, streamlining the coordination structures and improving stakeholders' role definitions and coordination mechanism by reducing unnecessary bureaucracy, by finding clear and non-overlapping roles for the committees. Number 3, Honorable Speaker, of the recommendation is strengthening the justifications of the policy with more local data, which include Bomet County Health Facility data. Honorable Speaker, the 4th recommendation is expanding discussions on barriers on high healthcare access. The 5th one, Honorable Speaker, on the recommendation is defining the clear timeline and implementation basis. The 6th is the establishing a clear finance plan. Honorable Speaker, at first we didn't have the budget line for the same. So it will establish a clear financing plan for the for when this house pass this policy. It also expands the public awareness programs and enhancing high health equity and access of voluntary of vulnerable groups. Mr. Speaker, this policy also will strengthen the awareness so that we can prevent this problem of eye. Strengthening human resource development strategies. Honorable Speaker, this will also make the human resource development strategies on the same so that it can improve the problem of high care. Enhancing review and evaluation mechanism so that we have this, when we have this policy, this house, that we're going to have enhanced the review and evaluation mechanism. Number 10, it introduced community participation in M&E by implementing patient feedback, survey, and community engagement forums. Honorable Speaker, when the CPM came, they see through their data that most of the people are blind, not because of anything else, because the prevention was down. So when we have this policy, it will introduce community participation in M&E by implementing patient feedback survey and community engagement. The community also will have some engagement on the same. Number 11, integrate the ME with digital health system by utilizing electronic mechanism records, EMR, digital dashboard for the real-time analysis. Mr. Speaker, therefore, the committee recommends that the county assembly approve the Bomet County Policy Comprehensive High Policy Healthcare Policy 2025 session number 1 with the committee aforesaid recommendation. Furthermore, this is the committee recommendation that the county executive committee member responsible for health incorporate the said recommendation in the final published version of the policy within period of 90 days from the date of approval of this policy. Honorable Speaker, this policy is a very important policy, and it is a policy that will have assist our people. Recently, some months ago, we have some community screening all over some places in the county of Bomet, and we are this also make our committee that there is a need for the policy, and also this policy is now in the flow of the House, and I urge honorable members that we pass this policy so that it can assist us to make the county move ahead in making in stabilizing the problem of high in our county. Honorable Speaker, let me give to my member, Honorable Chipto, to second.
Thank you, Honorable Speaker, for this opportunity. I stand to second the approval of Bomet County IL Care County 2025 policy. Having this policy in place in Bomet County will give us a milestone, and I must appreciate the team which we took together from the beginning, the team from CPM, the team from Tenwek Hospital, the secretariat team, and the team from the Committee on Health. As you are aware, Honorable Speaker, eye problem has been a big challenge, and we were able to realize that most of our people are suffering and they lack information and knowledge. So having this policy will assist us a lot, because we will be able to identify through screening, to identify problems immediately so that they can be supported. There will be the process of assessing our people from dispensaries in our schools, various schools, from primary schools, and also in various facilities. Another thing is that we will be able to collect the data so that we can be able to know in every sector or in every ward how many people are suffering with different kind of diseases dealing with eye, and that will be able for us so that we can be able to budget for them. Another thing, another advantage of having this policy at hand is that we will be able to have the supply chain so that we can be able to know the amount of drugs or commodities needed in our facilities, which will be dealing with the eye health problems. Another thing, Honorable Speaker, is that we will factor in the importance of having the resources in the county government, and also we can have more partners who can support us to have machines in every facilities within our county so that we can support our people. Finally, I must admit that already we have received some machines in our various sub-county, which assist us in ensuring that our people are treated well. So, Honorable Speaker, allow me to urge our members that let's approve this policy, for it will assist us a lot. So I want to encourage everyone to support. Otherwise, I second. Thank you so much.
Okay, thank you. The motion movement as a second. I now want to propose that question understanding order 215B of the County Assembly standing orders. This County Assembly adopts the report of the County Assembly Committee on Health and Sanitation for the Bomet County Comprehensive High Health Care Policy 2025, session of paper number 1 of 2025, and partially Article 185 of the Constitution, approves the Bomet County Comprehensive High Health Care Policy 2025, paper number 1 of 2025, laid on the table of the Assembly on 12 March 2025. The floor is now open for debate.
Thank you very much, Mr. Speaker, for the opportunity to also contribute on this report on eye policy by the Committee on Health. Mr. Speaker, I want to applaud the committee for coming up with this policy that deals with our health care and in particular the eye. Mr. Speaker, I have looked through the policy, and the policy generally talks about trying to put across the structures and to marry this policy with the primary healthcare policy that is run by the national government. Mr. Speaker, I have tried to look through this policy, and you realize that issues to do with eye healthcare, Mr. Speaker, has given a number of people a challenge. Looking around, Mr. Speaker, I was trying to see whether there are honorable members with classes, and I already find that we have two in the House. That tells us, Mr. Speaker, what we are, there are three, Mr. Speaker. That tells us we are speaking about real things that happens to our people across Bomet County. Mr. Speaker, in this policy, I would have been so happy to see how this policy will ensure that any person, right from the grassroots, from the dispensary, can be assisted for referral cases. I have not seen in this policy a structure on how to manage the referrals on the eye problems, Mr. Speaker. Again, Mr. Speaker, I would also expect that we have that wing in the health department of the eye, the dealing with the eyes, Mr. Speaker, so that we can develop these policies simultaneously. That is the eye health policy. We need also to have the ear health policy, and we also need to have the dental health policy, Mr. Speaker, so that as we give structures, as we enhance the performance of the health department to really cover those areas, we will have really supported our healthcare properly. Mr. Speaker, I also want to challenge the Chair Health that now that we have the policy, and I have seen from this policy that the time frame is 90 days, I would also want to challenge him that by the time this policy is published, we also need to ensure that it is rooted in law, Mr. Speaker. I expect that we'll have a bill to entrench this policy in our constitution, Mr. Speaker, and more so our county acts that we have. So that's the challenge I'm going to give the chair. Otherwise, I support this policy, and I would even, Mr. Speaker, ask that if time will allow, you can give an opportunity to these honorable members with classes so that they can expound on it, Mr. Speaker. Thank you very much.
Mr. Speaker, I also want to support the policy, but before I do, I've always thought and believed that people with classes are wealthy, and the wearing of classes signifies a change of status, Mr. Speaker. Until today, that the honorable member is saying that those with classes are sick. I'm sorry, because I've always thought it otherwise. Mr. Speaker, as I support the policy, I support the adoption of the committee's report on the policy. As a rejoinder, I know as we conclude, you will hand the microphone back to the Chair Committee on Health and the member of the motion to kindly elucidate more on the following areas that are highlighted as prevailing challenges on the primary healthcare services. Mr. Speaker, it is through this statement and policy that I'm being informed that eye healthcare has not been incorporated into the primary healthcare system. Mr. Speaker, when you look at the Bill of Rights, and specifically Article 43, that forms the basic structure of the Constitution. The access to healthcare is a primary right, and we have lived with the Kenya Constitution 2010 15 years. And if the same has not been realized, if primary health care has never incorporated eye health, then I think Bomet has been driving on the wrong lane. Mr. Speaker, I wanted to highlight on the challenges identified. And Mr. Speaker, the chairman will again tell us the ownership of the policy, if it is Bomet bound or it's sponsored from outside. Mr. Speaker, that Bomet County has a significant burden of eye diseases, including cataracts, refractive errors, glaucoma, and diabetic retinopathy. That there is inadequate access to specialized eye care, especially in rural areas. Mr. Speaker, I've read through the policy, and I'm yet to find a section that tells us that by adopting this policy, the inadequate access to specialized eye care, especially in rural areas, will be mitigated. Mr. Speaker, that a shortage of trained ophthalmologists, optometrics, and eye care professionals limits service delivery. Mr. Speaker, I would really want you to allow the chair to respond to the three, that by adopting this policy, we shall not have shortage of ophthalmologists again, because the policy is good. If it will allow the county government to budget the inclusion of primary health care, eye health care services in the primary units, in the dispensaries, and the community health promoters, we will welcome the idea. But kindly, the committee should give a clear framework to the achievement of the same. Otherwise, I support, because I think I once again want to disapprove the honorable member for Mogogoshe, because I've worked hard to buy myself sunglasses, thinking that they were a show of majesty, Mr. Speaker. Now he's saying that those in classes are sick, so he's killing my dream of owning very expensive sunglasses. But I support the policy, but not to ban people from wearing glasses, Mr. Speaker. Thank you, and I support.
Okay, thank you, Honorable Member. Honorable Eric.
Thank you, Honorable Speaker. As you may clearly see, I wear specs, and I don't wear it for aesthetics. I wear because over time, as I grew up, Honorable Speaker, I realized my focus on the whiteboard or the blackboard, as we called it back in the day, was really was a challenge. And so I don't have specs for aesthetics or to make me look more handsome. I know I was already handsome. And if I was not handsome, God will replace with something else. But I rise to support the adoption of the policy, comprehensive eye care policy of number 1 of 2025. And Honorable Speaker, I must admit the fact that the committee chaired by Honorable Chang Morik, a friend of mine who I respect a lot, has worked so hard to make sure that this policy come to the floor of the House today. Honorable Speaker, I know you are one of the members of the committee also, and without a doubt, there's been a lot of energy over the past few weeks trying to make sure that this policy has seen light of day. And I want to thank our partners and the committee, the County Executive Department of Health, for working so hard and tirelessly to make sure that we have this comprehensive eye care policy today. Part of what we need to understand, Honorable Speaker, is the eye care situation analysis that was conducted by some of our partners in Bomet County. Gave us a lot of insights into the need to have a policy in place to mitigate issues related to health care. And as a county assembly, we are very focused in supporting every health sector, and part of the health sector that we want to support is on eye health. And maybe I want to refer my colleagues who maybe probably have raised a few issues on the key policy areas, and that is in page 12. And part of it is in the integration of eye care in the primary health care. And this is the key policy areas. and expansion of the eye care services at dispensaries, health centers, and hospitals. This is part of what we are saying, that this policy seeks to address the high care issues to our health centers and our dispensaries, Honorable Speaker. And part of why we are here today is to really rally the Assembly in adopting this policy so that we entrench further the deepening of high health care within our county, not only in our referral hospital, but also in our primary health care facilities, even up to and including training our CHPs, that is community health promoters, who are with us and have done very good work in our communities. Finally, Honorable Speaker, I want to say, even as we age, and you know, this is a fact of life. I actually, when I grew up and I would see my grandfather trying to hold his newspaper away from him, I actually thought it was a style of the older generation. But geriatrics tells us that over time, our focus in terms of eye care is a problem, and if we do not take care of eye health as early as it is, then we will have a problem going into the future. So the mocking of people who are already wearing glasses ahead of time, I want to ask Honorable Kipchirchir and Mheshimiwa Kemo of Mogwasiek that they need to take care. In a short while, they'll be calling their firstborn sons to be reading for them letters and memos in this house. Honorable Speaker, I support the policy.
Mr. Speaker,
and I
point
know
of order,
someone
Mr.
has to
Speaker.
raise a point of order, Honorable Speaker.
Point of order, Mr. Speaker.
And I want to say, Honorable Speaker.
Point of order, Mr. Speaker.
Honorable Ernest.
Mr. Speaker, I want to, I'm raising on a point of order to that the honorable member is insinuating and spelling doom for us, Mr. Speaker, that soon we develop eye problems. Mr. Speaker, in fact, as he seeks to withdraw, it is good to notify him that, Mr. Speaker, high health care begins right from birth, Mr. Speaker, from what he was fed with up to date, Mr. Speaker. So we are not contemplating any classes anytime soon, Mr. Speaker. So you need to withdraw, Mr. Speaker, because he is insinuating that our future is doomed. Mr. Speaker, thank you.
Honorable Eric.
Honorable Speaker, let me clarify. I want to clarify this, Honorable Speaker, that high health care is not an issue to make fun of. So it is not nothing like we. I was just giving a caution to them that when they start seeing newspapers from 1 meter away and not just as close as we are seeing now, then they will start knowing that they ought to have.
Mr. Speaker, of order, Mr. Speaker. You need to withdraw the wish.
It is not, Mr. Speaker. It is not a wish, Honorable Speaker. It is something that I want to warn them ahead of time, and maybe even probably, Honorable Speaker, maybe even to educate them that even the firewood that they use in their kitchens, Honorable Speaker, maybe it still uses firewood. If it still uses firewood, then it needs to take care, because that is what part of a contributing factor to high health, Honorable Speaker. So there's nothing really that we wish them. We wish them well with their high health, because all of us cannot be wearing specs here. We will all look funny. So some of us, I know I would look good in specs. You can only imagine Honorable Ernest wearing specs, Honorable Speaker. You would be a scarecrow, Honorable Speaker.
Mr. Speaker.
So I want to say...
Point of order, Mr. Speaker. I don't know the much power that he enjoys, Mr. Speaker, to continue insulting us. Mr. Speaker, with your permission, Mr. Speaker, I want to ask that Honorable Eric is reprimanded, Mr. Speaker. He has continuously wished us...
Point of order, Mr. Speaker.
Mr. Speaker, I'm on a point of order, Mr. Speaker.
Let him finish.
Mr. Speaker, my seeking of point of order is to ask Honorable Eric to stop insinuating and wishing us bad things, Mr. Speaker. He has even gone ahead to describe some of us in classes, Mr. Speaker. So I don't know why you allow him to make fun of us when we had asked them to just explain how it feels, what caused them to wear those glasses, It wasn't bad, Mr. Speaker. So you need to withdraw instead of describing us to look like we are cartoons, Mr. Speaker. Thank you very much.
Honorable Monica.
Thank you, Mr. Speaker. I would like Honorable Kipkemo to withdraw what he said. He said it's all our wearing of glasses is all about diet. It's not that we were fed poorly. For my case, when I was studying, I used to use computer for long hours. That is why I was affected. So he needs to withdraw. It's not about diet. Thank you.
Okay, I believe Honorable Eric has cleared what he was saying.
Thank you.
Honorable Ernest, what you mentioned the first instant that people wearing glasses may be having eye problem, but you wanted them to maybe explain why they are wearing glasses, and it has been explained by Honorable Monica. Yeah, at least in one way or another, they may have had eye problems. And then, as Eric has said, as we grow old, it will reach a time where you may be diagnosed with poor vision, which may also lead to all of us wearing glasses. I think the point was clear.
Thank you, Honorable Speaker, for risking me. And thank you. I know maybe before end of day today, Honorable Ernest will be able to go check his dictionary and maybe probably check on what I said about geriatrics. Maybe he does not understand what geriatrics is. And also, maybe I'd add one word that is also paranoid, that on a future dates, things would happen. But nevertheless, Honorable Speaker, I want to urge our honorable members that we adopt this policy and that we...
Mr. Speaker, point of order, Mr. Speaker.
Want to...
Is it in order for Honorable Eric to call me short-sighted when I don't wear glasses, Mr. Speaker? You've heard him again trying to use semantics, not knowing that I understand more than he do. Mr. Speaker, I'm not being short-sighted. Let him withdraw that word. For the third time, Mr. Speaker, I've asked you to ask him to withdraw. But I don't know what is so difficult, Mr. Speaker, that Honorable Eric has continuously...
I think I'm going down. If Honorable Eric mentioned that you are short-sighted, I think it is high time you withdraw the statement.
Honorable Speaker, can I clear this statement? Geriatrics in this case is a study of old age, so it's nothing to do with being short-sighted. Paranoia or being paranoid is just being afraid, being excessively afraid of something that might befall you. So I don't know whether any of those two words would fit into the bracket of being short-sighted, Honorable Speaker. I don't know what semantics Honorable Ernest or what his fear is. I just said he's being paranoid, which means he has a fear of something that might befall him on a future date. So I don't think I've mentioned anything on being short-sighted. Maybe so, though he was an English literature teacher, maybe I would want to maybe a bit school him on English and maybe the study of the language, so that when he texts on me, he's able to understand those basic conversation lines. So that he's able to contribute meaningfully in this assembly. Having said that, I want to support this policy, and I want to say, Honorable Ernest, we love you and we support the policy. Asante sana. Thank you so much.
Honorable Bernard.
Thank you, Mr. Speaker. Considering the policy at hand, let me thank the chair for L and the committee for L, having have come up with a clear policy. Having have gone through this policy, Mr. Speaker, I was just saying that the strength of this policy And comparing with the weakness, the strengths are just fewer than the weaknesses, Mr. Speaker. As far as this policy is good, I wish the Committee of L will also go to review this policy, because we need to do some improvement considering the weaknesses you have given about the policy. Because we don't want to pass a policy, so that policy will only have been passed, but it is not being affected. So I'm urging the Committee of L to review the policy as we go along, but we will pass this policy as soon as possible. Otherwise, I wish all members, let's allow this policy to pass through, and we go to we will make as we go along for a review. Thank you.
Okay, Honorable Chair, I want to give you 2 minutes for right of reply. Okay, we are running. Be careful, Honorable Member. We are running out of time.
Okay, thank you, Honorable Speaker. Let me thank the honorable members for the very good support for this. Honorable Speaker, something to clarify just on the service delivery, that the policy contained in the creation of the eye health care in primary health, an expansion of high service to dispensaries. Those are one of the issues that the policy touches. Concerning the public awareness, Honorable Speaker, we are also going to, the policy is stressing on county-wide eye health education and outreach programs, maybe school-based vision screening programs. There is also another thing which maybe they have taken time for the honorable members talking about people who are using the same, but in the policy there is some these are the promotion of health care practices. So wearing of this is somehow, they say, including use of protection, protectives, eyewear. So sometimes wearing of those is protecting, making some protections on their eyes. Honorable Speaker, to end to this, let me thank the honorable members for this policy. And also the policy, as stated by Honorable Chair for Agriculture, Honorable Peter, that the founder of the policy, we have a partner, Christian Blindness Mission, which came to Bomet 3 years ago. They went around, do some screening, collect some data, and through that we find that there is a problem and we need to solve it through this policy. The CPM are handling their program. They want to live and they want to see the sustainability of what they have done in the county. One of it is to address through a policy so that we have a guideline on the same challenges that they found in our county. So we want to thank the CPM that they do some screening, they do some facilitation, in even the human resource. There is some doctors that have been are now in schooling through the partner, and we are going to have a sustainable way of solving this problem through what the policy has stressed in we have mentioned in the policy. So I want to thank the Honorable House for this debate, and I just still urge the House to approve the policy so that we move forward for more implementation. Thank you, Honorable Chair.
Okay, thank you, honorable members, for your contribution. I now want to put the question that pursuant to Standing Order 2015B of the County Assembly Standing Orders, this County Assembly adopts the report of the County Assembly Committee on Health and Sanitation on the Bomet County Comprehensive Eye Health Care Policy 2025, session on paper number 1 of 2025. And pursuant to Article 185(4) of the Constitution, approves the Bomet County Comprehensive Eye Health Care Policy 2025, session on paper number 1 of 2025, laid on the table of the Assembly on 12th March 2025. And will as many as are of us, similar opinion say aye?
Aye.
Will as many as are of our contrary opinion say nay? The ayes have it. members, I've received an invitation from the County Government of Bomet, Department of Health Services, that members of this county assembly are invited to attend the Bomet County Vision Impact Project achievement celebration and launch of the Comprehensive High Health Policy 2025. This event will recognize our collective achievements in high health care and mark a new chapter in our commitment to vision for all residents of Bomet County. The event will be held on Wednesday, 2nd April 2025. That is tomorrow at 8:30 a.m. There will be very many activities during the event. There are 2 venues which have been selected for this event. That is, there will be a tour of Dr. Choice Laposo Memorial Mother and Child Wellness Center by the chief guest, followed by the main program at Longiza County Referral Hospital. The Health Services Department is mentioning that this occasion will mark a significant milestone in their collective efforts to improve our health care services across Bomet County. They will also be celebrating the remarkable achievements of the Vision Impact Project over the past 3 years, which has made substantial progress in addressing visual impairment and blindness in our communities. The highlight of the event will be the official launch of our Comprehensive High Health Policy 2025, a strategic framework that will guide our high care services for the years to come. So members are being requested to attend this very important function. The function will be graced by His Excellency the Governor, Professor Hilary Parchok, and Mr. Mbake Nyang, LPE CPM Global Director, will be present. The event will also include cultural performances that celebrates our community and diversity, and a session foster a continued collaboration. So, honorable members, let us purpose to attend this function that will be there tomorrow. I would wish that you could also have a dance as honorable members, because this policy originated from this assembly, and minutes ago you have also approved the policy.
I'm raising on a point of order, Honorable Speaker.
Honorable Peter.
I've seen the calendar. Tomorrow, in the County Assembly's calendar, we will be in session. Are you, in other words, suspending tomorrow's program so that we can attend the launch of the policy that is 30 seconds old, Mr. Speaker?
You will be required to make your own maneuvers. That is the sitting in the will go on as has been programmed. Honorable Peter.
Mr. Speaker, point of order also to inquire something, Mr. Speaker. Assume if we will not have passed this policy, will that validation be valid? If it was not passed.
We couldn't have.
Yeah. If we could not have passed the policy, will that validation be valid?
Point of clarification, Honorable Speaker. Point of clarity. The invitation, a minute, Honorable Member. The invitation arrived when the policy has been passed. So the two are not related in any way.
Another.
Honorable Chair.
Honorable Speaker, the invitation was, well, maybe in their program, if the policy was not passed, they might have removed the policy launch. But the program of the guests will go on, because on 31st, which was yesterday, they closed their chapter in Bomet, and they want to say hi to Bomet after having the program for the 3 years. So the donor has completed the program, and you want to say some progress and milestones and whatever tomorrow in the field, in the presence of the Assembly and the Executive. That is why it was valid, Honorable Speaker, if we can have, if there is any power, according to our standing order, that we get permission for the same ceremony, so that we cannot, will be sure that members will attend. It was good if we can, if there was any, maybe through majority leader or who, that we can maybe have time to suspend the sitting for tomorrow so that we attend, because it was a very important thing that has taken 3 years, and there is a lot of progress and achievement in Bomet through the same donors.
Honorable Speaker, in addition to what the Chair have said, remember the ambassador will be there, and you are aware that we also need resources for the policy, so that it can be effective. Of high time for us to be able to talk to him and to her and request her for more funding. I suggest afternoon.
Okay, it will be upon the majority leader to request that the house be suspended. Honorable Peter.
Mr. Speaker, I hope the chapter on the healthcare policy is closed and coming up, and it comes in as an adjective and as a noun at the same time. But I want to make reference to part 21 of the standing orders, Mr. Speaker, that the House Business and Rules Committee consider the reintroduction of the Implementation Committee as part of the select committees of this House, Mr. Speaker, so that policies, good policies like this, are followed up to implementation. We've made recommendations, very aesthetic and very good in nature, but few of them gets implemented. Mr. Speaker, if you look at the motion that was adopted, the motion about adoption of a report that was adopted in this House on the 27th of March 2024, that had recommendations that were supposed to save the water department here in Bomet. Mr. Speaker, all the recommendations were good, but none has been implemented, despite the same recommendations having timelines. Mr. Speaker, I decided the other time to make an amendment to the standing orders, but my proposal was shut down at inception. This time around, I would ask it to be done through the House Business and Rules Committee, so that the same is effected. Mr. Speaker, the Committee on PIC made recommendations that were time-bound. One of them was that the comprehensive staff audit be undertaken by the management within 30 days. The same has not happened. So, Mr. Speaker, as I end, I ask you to invoke the element of part 21 of the standing orders and consider, because I know you sit in the House Business Committee, reintroducing a subcommittee on implementation, so that what is passed here is followed through by the same committee. Thank you, Mr. Speaker. It is a request and, of course, a proposal. Thank you.
Okay, thank you, Honorable Member. As I've mentioned, Honorable Majority Leader can come up with a motion to hold the calendar. so as to allow members attend the launch. So it's upon the majority leader to come up with a motion to alter the calendar and table in this house, and members will discuss.
As per the request by members to adjourn so that they attend that very important function tomorrow, I think it is indeed a very important function that is also participated. I think, again, according to the standing order, moving a procedural motion means altering the calendar. And I think it is only possible we sit here in the morning and adjourn so that we attend that function. Thank you, Mr. Speaker.
Thank you. Adjournment. Adjournment. This sitting is adjourned tomorrow at 9:30.